Hello, everyone. You're very welcome to our sixth seminar in our Research in Action series at Trinity College Dublin. My name is Luciana Lolich, and I'm the Research Impact Officer at the School of Nursing and Midwifery. And this series explores how research can drive real-world impact in policy and practice. We are delighted to welcome Professor Imelda Coyne, Director of the Trinity Research in Childhood Center. A global leader in child health research, Professor Coyne has played an important role in shaping national policy through consultations that inform Ireland's better outcomes, brighter futures, and first 5 early year strategies. Her work focuses on children's rights, participation, and shared decision-making in healthcare. She also serves as an expert advisor to national and international bodies, including the National Council in Bioethics. Through her research and advocacy, she champions evidence-informed, child-centered policy development that recognizes and elevates the voices of children and young people. Thank you for joining us today. Professor Imelda Coyne, over to you.
Thank you, Luciana. That was a lovely introduction, and welcome everybody. I'm going to talk today about how we can embed children's voices in the heart of policy making and use examples from my research and my work to date. So, sorry, this is not moving. So if we look at the facilitators of how to get research into policy, these are well known and include credible and trusted evidence, co-production and stakeholder involvement, policy relevant and timely research, clear and accessible communication between researchers and policymakers, alignment with policy priorities, strong relationships between researchers and policymakers, and also knowledge brokers and intermediaries. So an example of a knowledge broker would be the Health Research Board, who funds a lot of research in Ireland, and they would disseminate the research and publicise it and do lay summaries of people, provide lay summaries of research. But all of these facilitators I'm going to address in one way or another by showing you examples of how I tried to get my research into policy. So why does children's participation matter? Why do their voices matter? Well, for many that I'm speaking to, they will accept it without a question that participation is essential for effective policy making. And children are experts in their own lives. And so we need to listen to them, talk to them, and allow them to participate. More than allow, actually encourage them to participate and support them. Participation improves relevance, equity, and outcomes for children nationally and globally. The United Nations Conventions on the Rights of the Child, particularly Article 12, which was established in 1989, that reaffirmed and stated and reaffirmed the rights of the child to participate, to have their voices heard in all matters affecting their lives. And I have been working in this area for many years to try and promote children's rights to participation and to enable children to participate. So what do we mean by participation exactly within healthcare particularly? These are 4 key areas, and from Laura Lundy's model, but also from a lot of work that I'd have done and other people have done, which is to talk about that children must have the opportunity to express their views. So space must be created for them to be enabled to express their views. When they voice their preferences, their opinions, that they are given support to express their views, that they're not overruled or overlooked or ignored or not given that support. Audience, it's about adults who genuinely listen. And if they cannot take into account what the child is saying, that they explain why. So it's not just listening, it's also responding and acknowledging what the child has said. And influence is that their views must shape decisions. So we have moved a long way from tokenism to consultation with children, to collaboration, and to co-production. But still, we will have instances where, some of the forms will be very tokenistic and children will be involved, but in a very marginal way, and that box is ticked. But it's really important that we collaborate and that we actually co-produce research with children and young people. That's important. When I talk about children, often I don't say and young people, but it's meant to include young people as well, adolescents, teenagers. So the embedding children and young people's needs into policy, an example of that would be the Better Outcomes, Brighter Future, which was our national policy framework for children and young people in Ireland. And that was established in 2014 and ran for 6 years. And there's another policy that has built on that since. But I, because of my work in this area, and I had been doing a lot of work around children's voices, listening to children, research with children, I was successful in getting the tender to run the consultation with children and young people to inform this national policy. And our report was called Life as a Child and Young Person in Ireland. And we conducted a survey with children and young people across all different settings, from primary school to second level, to outreach, youth reach centres, to schools all over Ireland. And we had a very good response rate. We had 66,705 children and young people respond. I have to say that what was really important in this piece of work was that the children and young people, work had been done with them prior to conducting the survey by the Department of Children and Youth Affairs, where they'd held focus groups and discussions and a big event with primary school children to ask them what are the key questions that should be included in this survey. And they were the children and young people designed the survey and designed the questions. And we also had an oversight committee made up of key people from the primary care sector and the second level sectors. We worked with a very good team of policymakers from the Department of Children and Youth Affairs, Anne O'Donnell, Dr. Sinead Hannafin, Dr. Anne-Marie Brooks, and Olive McGovern in particular. But there were many people involved. And it was about feeding children and young people's views into the national policy. And you can see that it did reflect their views, the outcomes and the aims and objectives in the actual Better Outcomes, Brighter Future. One of the key areas named in that report was that consultation with children and young people on policies and issues that affect their lives is a key priority for the Irish government. Then a second one was that ensure the views of children and young people are taken into account by all policy making forums. So that was a really good thing to be included in the report. The second key area where we embedded research into a policy was the second biggest national policy here in Ireland. It's called the First Five. It's freely available. It's called the Whole of Government Strategy for Babies, Young Children and Their Families. And it is still running till 2028. Again, I was successful in securing the tender to conduct the consultation with young children. And I think that also built on my work that I had done a lot of research with very young children, with colleagues in Scandinavia, in particular in Sweden, and had experience of research with very young children. So I was not daunted by this. The children that we accessed were aged 3 to 5, and they were from a variety of settings. And what made this successful in documenting children's voices and having their voices and their opinions and their preferences included in the whole of government strategy was the support from, again, the Department of Children and Youth Affairs, and particularly Dr. Anne-Marie Brooks, the Oversight Committee made up of early learning centre staff and early years staff. And also we had early years specialists, and all of them are named there, along with myself and my research team, which was Deirdre Mallon and Emma Chubb. We also had 6 early years specialists who helped us conduct this research. And prior to doing this research, what made it work quite well with very young children was that the questions were tailored to the developmental level of the children. And we did a lot of work around using art and asking them to do drawings, and then asking them what was their drawing saying, what were they trying to communicate with us. So that's a second example. So if I move on to a second area of my research, which is about promoting children's participation and preferences in communication and decision-making in hospital. My research briefly with children, I've conducted several pieces of research, but this kind of stood out for me as this little girl said, "My wish is that doctors and nurses talk to me." And a little boy said, "I'd like them to explain it more because it makes me feel braver and more involved." So they want to be included in communication and information that's going on in the healthcare setting. So why is this important? Why is it so important that children are included? Well, there are many benefits for children, and research has showed this, that they have increased understanding, they're more satisfied, but more importantly, they feel valued, they feel heard. It makes them feel less fearful and less anxious. They're more likely to cooperate and adhere to what is planned for them. They have increased trust in the healthcare professionals, that they are there to help them and make them better, and that they are good, kind people. And these are the terms that children used. Older children have talked about feeling more in control, feeling less fearful, having some locus of control, and helping them to make decisions and improving their ability to make decisions. And conversely, when we ask children, how does it make you feel when you're not able to say what you want to say, or you're not being heard, they talked about being very fearful, anxious, feeling unprepared for procedures in particular, reduced self-esteem, as one little girl said, which wasn't little, she was age 12. She said, "It made me feel like an object. I wanted them to talk to me." They used a variety of terms, from feeling lost, lonely, sad, disappointed. And the result of all that, if you see it, it's in a circle, because it all impacts, one impacts the other, is they end up feeling very confused, and then that leads to more fears and anxieties. So their participation is really important. And other research that I did with children around their participation, they talked about small and big decisions. And small decisions were everyday decisions in the healthcare setting. These could range from, if they're having the blood pressure taken, which arm that they'd have the cuff put on. If they're having their temperature taken, how would that be done? If they were having their foods, when they were getting dressed, when they were going to the playroom, all these everyday decisions, or even just a decision about what plaster to put on their arm after a blood test or whatever. And then there were the really big decisions, which they termed, the operations, the medical treatment, stuff like that. But what children said that really mattered to them was many of those small decisions. If they were due to have some procedure and they asked for more time or asked for it to be delayed because they wanted time to adjust to that they had to have it. But that when nurses gave them that extra bit of time, they really appreciated it. They appreciated flexibility and being heard and being supported. And they said, they may be small decisions, but to us, they're big decisions. And sometimes in healthcare settings, professionals think it's all about children taking part in the very big, serious decisions, and they worry about giving children that responsibility. And they're fearful that we're giving children too much to decide too quickly. But children are not saying they want to take part in the big decisions on their own or take responsibility for those. When they talked about that, they were talking about sharing those decisions with their parents and the healthcare staff. And they were very clear to say that our parents are there to mind us and take care of us, and they want the best for us, and that the healthcare professionals, doctors and nurses, they do a lot of training and education, and they know what they're doing. So these were important distinctions. So how did I bring that research into policy was because I published a lot of papers in it, but I also did keynotes, conferences. I wrote short pieces that were translated into simple language. And these, my research was included, and I was also a member of the group that was involved in the national strategy on children and young people's participation in decision making, which was our third big national policy here in Ireland. And we've been commended on that in Europe, that we had that national strategy. We had that policy that says that children and young people should participate in decision making, not just in healthcare, but across all domains of life, from social services to education to healthcare, etc., to schools. So we've had that national policy, and it's been great. And since then, we've had a participation framework, which was developed by Professor Laura Lundy from Northern Ireland. And that sets out in more detail how children can be supported to participate in decisions. And now we have a new an action plan since 2024, which talks about supporting children's participation in decision making. And around the same time as my work in these areas, I was fortunate to be invited onto a committee in the Nuffield Council of Bioethics, well, a working group we were called, where we looked at how children should be involved in clinical research and came up with a set of recommendations. And my work was cited extensively in that document, in that policy, along with many others. That children in clinical research has been disseminated worldwide. And we did an animation film explaining it for children. And we also did a summary that was translated into many languages. Some of the research that I had been doing around children's participation featured in an article called Talk to Kids About Their Healthcare. And that was disseminated in a free journal. It's called Hospitalist News, across to all healthcare workers. There were pediatricians or anyone who worked with children in hospitals. And I had contact from many people in the States around that. Excuse me. It was also cited in 5 UK policy documents, and then I did an interview with Nasi Pharma, a journalist from New York, who featured my research under the title "Knowledge Can Reduce Anxiety in Hospitalized Children." So that just gives you an example of how sometimes you can work away, be very persistent and research in the area and think you're not going to make a difference, but eventually it does pay off. And the other impact was there's a guide to children's participation in decisions about their health developed by the Council of Europe, and I was involved in that. And they have produced a booklet which for children, which is called Your Health, Your Say. And it's worded in easy to understand language for children. And it's a booklet that tells them about their rights to participation. And I also was involved in the Council of Europe review of their policy and how is it doing across Europe, including 46 countries. And I also spoke at I was an invite from Monsieur Charles Smith, the Ombudsman for Children in Luxembourg, at their recent conference. And thank you to Dr. Lawrence Wolf, the Secretary of the Committee, and Miss Oriel Pasquer, who invited me to speak. Moving on now to number 3, these are just 3 examples of where I've tried to make an impact on policy. This third area of my research is looking at how is the transition managed for children with long-term conditions when they move from child to adult healthcare services. And I was fortunate to get funding from the Health Research Board and from some other organizations to help do this various research projects on transition and looking at the views of young people. The project that I'm going to talk a bit about today is the Better Transition Outcomes for Children and Adolescents, that called the TRiCC project, and there's the team listed there. They were great. And Luciana kindly summarized the impact of that project, which led to funding for 3 other additional projects, more funding, and more dissemination. I'm just going to go through some of those in more detail. So what did we find when we did the transition from child to adult care for young people with chronic illnesses? That's why we called it TRiCC. We found that policies across these 9 services varied. Some had transition coordinators, some held joint clinics, some did visits to the adult centre, some did summary and transfer letters. I forgot to mention that in relation to this project, we did 3 systematic reviews. We also did surveys with young people. There were 217 surveys, interviews with parents, children, and professionals. And there were about 116 of those. We also held a participative stakeholder conference where we brought together parents, young people, and healthcare professionals. And we gave back the findings to them and asked them, how can we make things better? And what do you think of these findings? So these were the findings, as I said. The policies, they varied. The adolescents talked about varied a bit being ready. Some were ready, some were not. Many of them talked about not being prepared very well, anxiety about the adult services and new responsibilities. The parents were worried that their young person lacked the skills to manage in the adult services. They desired greater involvement. And for many parents, the transition was very distressing. When we looked at these, we looked at young people who hadn't yet transferred to adult services and those who had, and the same with parents. So we got views from both angles. The healthcare professionals, some tried to prepare the young people, but they talked about an insufficient coordination between the child and adult services. So these are the kind of 2 comments I think really illustrated that the findings was, for some, they said, like one young person said in particular, I don't mind, I'm fine with it because I'm eating now, so I don't mind, it's just another step. So it was a smooth process as far as they were concerned. But for many others, it was a very difficult process. So that photo there or image illustrates it, that it was like a swampy lowland, with a rickety bridge, the connection between the child and adult services. It said, I think it was the last appointment at outpatients. It was thanks very much, bye-bye, best of luck. It was just the way it was done. There was no come in, we'll have a chat about this, and what do you think, and how would you feel? So for many young people, they felt very unprepared for the move to adult services and complained about a lack of information. So that's a summary there of the key issues, key barriers that I've mentioned already. And the barriers for healthcare professionals. They talked about a lack of education and training, a lack of time to include and prepare young people, that it was difficult to include adolescents in preparation that was meaningful to them when you have short clinic appointments. Perceived deficiency in adult care. This is particularly from the healthcare staff in the paediatric setting. Inadequate support from adult staff and services when they were trying to transition young people. A lack of transition guidelines, standards and programs. This is at an organizational level, a lack of financial support and resources, insufficiently flexible services, inadequate transfer of medical records, and insufficient communication, like I've mentioned already. So these were all the barriers. So what were the facilitators? Well, these are the key facilitators that came out from our research, but also have been supported by research from many other very good teams of researchers across Europe and internationally. And that is that there's a need for transition standards and programs, that we should have a lot of preparation that's youth-centered on their needs. Transition coordinator, this is usually a nurse, that they play a key role, but it can be another professional. Joint clinics and child services, so that the adult team come to the child services and they have a joint clinic together, a dedicated young adult clinic. So I'm just going to talk about the first two key facilitators and trying to impact policy in those areas, or resources as well. We did a survey with young people that were in our study, but also other young people, because we thought we need to develop something for them that will make a difference. So we asked them, what would make things better with regards to the information and advice about transition? And they said they wanted that information and advice, and they wanted to, but more importantly, they wanted to hear other young people's experiences. And over 60% preferred to receive information via a trusted website, but they also mentioned an app. But we didn't have the funding to create an app, so we created a website. And how we went about that was we had all the evidence, but this is another point about embedding children's voices, young people's voices in policy, is that it's co-production and working with young people, because we had all the evidence. We drafted all the material that we thought we would put on this website. But when we went and built the co-design team with young people to design the website and materials, they were very quick to say, that won't work, that's not good, don't use that terminology. And so there was a lot of dedication from their end to work with the web designer and the team, to help develop these materials. And then we did experimentation with some young people as to how they found it and how easy. And it's so important. their views and their opinions and their how they guided this project, because they said, oh no, just have 2 clicks to get information, keep it very short, keep it very focused, and there were many other suggestions. So we did many different modifications of the material and the website, and then we launched it. And this is the website, steppingup.ie. And the young people chose the name for it because we had about 20 different names, because we had an advisory group made up of healthcare professionals and voluntary organisations, children from the Diabetes Ireland, Cystic Fibrosis Ireland, and Congenital Heart Children. And they were absolutely brilliant. All those people that were part of that stakeholder advisory group. But we also had the youth advisory group, and they said, well, why don't we go back to the youth and ask them what name would they prefer? And they chose that. And in that, we have thinking, planning, and making transition. And the young people asked for nice pictures of happy young people rather than sick young people, because they said, we're not sick. When you have a long-term condition, it's not that you're ill, it's that you have that condition. And they also asked for all these videos. And all those videos are there, listed. And you can click on them. And it has young people with those chronic conditions, diabetes, cystic fibrosis, congenital heart disease, talking about making the transition, talking about the questions you should ask, talking about how should you talk to your healthcare team, how should you plan your transition, and top tips. And those videos have been very good and very useful. And don't hold back. That one in particular, that video clip, is about that, when you go to the adult clinic, you need to tell them exactly how things are going and don't hide anything. So I have to thank an awful lot of people. And I think what made this really successful was it was youth-led research from the start, the analysis of the data, the co-design, and the dissemination. We were very fortunate to have Alan Southern, he's there in the middle picture on the bottom, who played field hockey in the 2016 Olympics for Ireland. And he tweeted about the website, and we got a lot of dissemination of the research because Alan had such a huge following. He did a lot of followers. And we also have Darren up in the top right-hand corner, who was part of our youth advisory group, who opened the launch and was instrumental in everything we did. We also had support from the pediatricians and from some other people and many organisations, Children in Hospital Ireland and all the other voluntary organisations I mentioned earlier. And that's thanks to all the people who are involved in this, because very much it's a team effort. And the impact and dissemination of it, we were fortunate that it was disseminated by ourselves across healthcare professionals and sites with a summary and with posters. We were profiled on television, radio, and in several newspapers. We did an interview in Morning Ireland, and Darren spoke a lot at that, which I was delighted about, because I accompanied him and I had to talk a bit about the project, but he really was the ambassador and the champion. It won Best Project in Hospital Award and was featured on many websites and blogs. But another issue, which I think is really important since I'm talking to you today about policy, is it impacted transition policies and standards in the sense that in Ireland here, we've been working for about 2 years, but before that we were also working on it prior to COVID. on transition guidelines, and that was published earlier this year. The Transition of Care from Pediatric to Adult Services, a National Framework. And it sets out the standards for how transition should be managed for young people with long-term conditions here in Ireland. And I'm delighted to have worked with many colleagues on that and to see that come to fruition. It's also been included in the framework for the care and support of adolescents and young adults with cancer in Ireland. Professor Owen Smith chaired that and that committee, and it's looking at the key issues around transition for young people with who have survived cancer. We also published a book highlighting the research that has shown how nurses lead on a lot of the work in the area of transition and how successful some of these interventions have been. And recently I was involved with a group in Europe around developing guidelines and standards for how young people should transition to adult endocrinology services across Europe. So that's showing the impact on policies and standards. It also led to collaboration with a team in University of North Carolina, and we developed a website based in the US, and it was resulted from a grant that mirrored the work that I had done here in Ireland, and it's called UVO, and it provides information and advice for teens. And the terminology is American because they all say teens rather than adolescents or young people. And it contains many videos done by young people around these conditions, and we've disseminated that. Impact globally, that research on transition plus participation and decision making has, thanks to Luciana for locating these statistics, has been cited in 61 policy documents across 24 countries, cited in major global organizations like the WHO and the UNICEF, and informed national and regional policy in other countries, and has also generated global media coverage. So, which brings me to an end. And before I end, none of this would be possible without having the support of very good researchers in my team, very good colleagues that have supported me and the research, but also the funding, the networking. So it's very seldom you can achieve anything on your own. It's all about a team effort. And, research does not move neatly from journal articles to government policies. In reality, it happens when good evidence, strong relationships, persistence, passion, and the right policy window come together. So I'm going to leave you with this, which is that, and which I've always felt very passionate about, is if we want policies that truly work for children, we must start by listening to them rather than us just developing them off the top of our head. I mean, policymakers, not me personally. And I believe, we've been very fortunate here in Ireland. We have a government who is very supportive and very progressive in promoting children's participation in matters that affect their lives. So with that, I will thank you for listening and leave some time for some questions.
Thank you so much, Professor Coyne. That was a great presentation, and I thought you said a lot of very interesting things. One that really struck me was these small decisions versus big decisions, and how children want a lot of small decisions also make a big decision, and how as well it not necessarily means that they want to make that decision on their own, but they want to be involved. And I thought that was a very powerful message. So we're going to give some time for people to put the questions on the chat, but I might ask a question first just to kick off things. And having listened to your presentation and everything you said and you explained so well, how significant you think that it was the fact that you gave children a voice in influencing policymakers, and what impact then you feel it had on the policy outcomes?
I think like in relation to the national policies, when we did the research, and there was a lot of hard data there, from the 66,000 plus children and young people, like it was a snapshot of how they felt about things living in Ireland, across Ireland. And that really influenced the better outcomes, brighter futures. Now, they did take that data and the findings, and they had adult kind of focused discussions around what they consulted with loads of stakeholders before that policy was done. And, the government officials would be best answer to that. But it was, when you read through it, you can see where their voices are embedded in the issues that were raised. So I hope that answers your question, but that's kind of like one example of where I do think it made a difference. And the same with the young children aged 3 to 5, because they talked about the importance of their parents being around, having time with their parents, worrying about their father working a lot. So a lot of the issues in the first 5 is about parenting support. It's about protective leave for fathers, So they picked up on the issues, but these issues were also raised by a lot of adults in this area. But I do think it's important because sometimes, I mean, maybe they're not very good examples because they're very broad, big policies, but sometimes I think adults decide what they know is best for children, and then they decide this is what it's going to be. And that often doesn't work, particularly with adolescents and older adolescents. They feel very, that they're kind of pigeonholed, and that adults think they know what is happening to them. So I do think it's so important that we talk to children. And as you said earlier about the small and the big decisions, when I presented on that, a lot of data from children, adult or healthcare professionals, particularly doctors, were surprised because they were kind of thinking, it's about the big decisions, and they were kind of surprised that would make a difference. But I think what sometimes people need their awareness just raising, because I've come across really brilliant doctors and nurses that are really good at including children and really committed to it. But then there's others that maybe need their awareness raising, that it's important and it's good for the child's well-being and the welfare. And once that's raised, then they kind of go, oh, right, okay, I'll try that. So it's about getting out there and speaking about it as much as possible and disseminating it. Yeah.
Yeah, and it was also very important what you mentioned in terms with young people of being involved, and with the website. I thought that was very interesting how, if you really want them to use the website, they need to be involved at every step of designing them and giving their opinion on it.
Yeah, that was a good point too, because like I remember when we devised the material, it was, myself and the research team, and we thought we have all the evidence, we know exactly what they need. And we had a youth advisory group, but we tried to pull it all together so we wouldn't take up a lot of their time, because every one of these young people had a chronic condition. So they were giving us their time to look at this stuff. So we thought we'd prepare it in advance, but my researcher had we had put things like "you should," and they said, "Oh no, take that out. That won't work with us. You can't use terms like that. You should, you must." So they forced us to really rethink and engage and take our time and have many meetings where it went through many reiterations till it really reflected how they would like a website and materials. Yeah.
Thank you. Something also that struck me through your presentation was your consistent and perseverance, continuing to work on an issue, even though maybe the attention might not be there yet, but you continue working on that, and then opportunities came and you were asked to give your opinion and for consultations. So what advice maybe would you give to maybe early career researchers trying to influence policy or affect policy? What do you think is important in terms of achieving that?
Well, I would say the most important thing, if you can have it, is that you pursue a topic that it's so important to you, that you feel very strongly about, that will sustain your interest. It's not something you're taking on because it's trendy or it's fitting in at that point in time. Because if you're not genuine and not really committed and really feel it's your passion, it's what is important, then that kind of feeds through to a lot of people. Like when things get tough, because research is not easy, you might not get funding, your project might run into loads of obstacles. If you don't have that persistence and that kind of passion about that topic, then you'll give up, you'll move on, you'll do something else. And the same, if you do the research, sometimes people think, I'll do the research, I'll write a couple of papers or try and do a few conferences, but that it doesn't stop there. And more, all the work, and part of this series, we would have heard about PPI. It's about translating this into very simple, easy to understand language for the people we research, for the children, for the families, to get that message out there rather than it just being published in academic papers. So, and to do that, you have to get out there and network and build those relationships. And, be also aware that, and I've got to make that point, is I remember, because when you come from an academic perspective, you try to put everything in a report. And I remember one of my first reports I did many years ago, I had about 40 recommendations. And the policymaker came back to me and said, because it was going to be launched by the Minister for Children at the time, that was back in 2010, 2012, said, no, can you give us 4 recommendations? Because we cannot meet all of these. This is the reality of policy making. If we agree this and we put it into a policy, then we have to deliver on it. So you need to be realistic. And I wasn't being realistic. I wanted to change everything overnight. So you kind of, by engaging with policymakers, you learn what are their priorities, how do they see things, and that, you have to trim your sails sometime and just go for the 3 key messages you want to get across.
You need really to understand how policy making works now as well, and not just come from your side, but that's very interesting and very useful advice.
Yeah, because I think the barriers to getting your research into policy is when people do research and think, well, everybody should take it on board and adopt it and think it's wonderful. And I've done amazing work, when that same research could be being done by many other people. But what matters is you not sitting back and thinking they'll come to me. It's about how can you engage with policymakers in different variety of settings. So you don't just, think they're going to automatically turn up at all healthcare conferences, because they might not. So it's where can you engage with them? And the other point I would make is when you have the voices of children and you have credible evidence, but you also have support from the families, the parents, the voluntary workers, because they're trying to do the same, these advocacy groups. They're trying to fight for the rights, the resources for children and families. And so they're your allies, and they are very used to kind of, getting the message across in an engaging manner. So they can help academics, who can sometimes struggle in this area. We're not all like media personnel.
So it's important to know the landscape really well and network and look at other stakeholders that might have the same objectives, or at least share some objectives with you.
And learn from others, because they, if there is research being done elsewhere, or even in other countries, is there strength in pulling that all together and saying, this is really important for children and young people. Yeah.
Thank you, Professor Coyne. That's very useful information, a lot of very useful points. I think I have a question here. Thank you so much for an excellent presentation. It is so inspiring as I begin a journey to include children with disabilities, express views about their digital lives into policy and regulation discourse. I have just finished my PhD project where I talk to children with disabilities about their digital worlds. Their views are very different from their parents, policymakers, and regulators. This seminar has been so inspiring and motivational. It is so practical and honest with excellent advice. Okay, there's no question there, but just a lot of praise and excellent. It was excellent presentation.
Thank you, Rose, for that. I can see it there on this side.
Okay.
Yeah, I'm best of luck with your research. When you find that, the children's views are different from the parents, policymakers, and regulators, then you have to work hard to try and explain and challenge others' views. Like we did find that when we, in any of the research I've ever done, I always had an advisory group as well as a youth advisory group. And, I remember my research team at the time, the brilliant researchers that I had where I was working with said, so do we go with what the parents and the adult advisory group say, or should we go with what the children, like who has the overall say when it comes to what we change in this stuff we're doing? And I said, go with the children and the young people, because they are the ones, it's about them. And we just need to explain why we're doing that. And, because sometimes parents and adults, they need their awareness being raised that they don't know everything, and that they're not the experts necessarily in their children's lives. Yeah.
Yeah, thank you so much for that question. I think that's our final question. So I just maybe going to finalize here. Thank you so much, Professor Coyne, for sharing your experience with us. Thank you, Elizabeth, for the technical support. And thanks to everyone who joined this session today. And we hope you leave with fresh insights and inspiration for engaging with policy. Just a reminder of our next session. And I thank you all, just if you want to register, and thank you all again for being here with us today. Have a lovely afternoon, and thanks again, Professor Coyne.
Thank you very much, Luciana. Thank you.